Now, during this crisis, many in civil society have stepped in to help during the oxygen shortage. One such effort is Mission Oxygen, which was started on 23rd of April with the aim to rush supplies of oxygen concentrators into India and distribute them free of cost to hospitals. 250 startup founders have dedicated themselves to make this happen. On 30th April, Mission Oxygen landed the first consignment of oxygen concentrators, and it's supported by several foundations and individuals like Sachin, Tendulkar, Shikhar Dhawan, and thousands of well-meaning citizens. Well, to talk more about this, we're joined by one member, Rehan Yar Khan, managing partner of Orias Venture Partners. Thank you so much for speaking to us. First and foremost, tell us, how did this come about, this Mission Oxygen effort?
Well, it just happened impromptu on the 23rd. Actually, some of these founders were looking to make a donation. And when they went to make a donation, they realized that, their donation would be just a drop in the ocean, number one. And number two, giving money was of no value because there were no supplies. There was nothing you could do with the menu, with the money. So then they decided to organize the supply chain to import these oxygen concentrators. Within a week, which is on 30th of April, they managed to land the first consignment, distributed those to many hospitals like, NCB Hospital, Pentamed Hospital, and many other hospitals. And now what they've started doing is they've organized a consignment to land every 48 hours and distribute these.
That's amazing, a consignment every 48 hours. Tell us a bit about, the challenges that you face, because it couldn't be easy, to import these oxygen concentrators. You had to find vendors as well. Then, of course, there must be some sort of bureaucratic red tape that you had to also negotiate.
Sure. I think the biggest challenge was, of course, the flights into India, because flights into India, as you probably know, are cancelled. Civilian flights are cancelled, so we had to rebook it. The original target was to land them on Wednesday. They landed on Friday. So they got rebooked 3 times. Finally, a dedicated freighter had to bring these in. And now whatever is going to come is coming in on dedicated freighters because passenger flights are cancelled. So that is the biggest challenge. Yes, procurement has been a challenge. I mean, because, the factories had to provide a short notice. Remitting the money out of India was a challenge. It takes 2-3 days to get that. You have to get the paperwork cleared. But we pretty much figured out this entire chain, and that's why now we're in a position to land this consignment every 48 hours. We've been well supported by fundraising. I think our fundraising now has reached close to 30 crores. A lot of people have been coming forward and just donating, many foundations. So that's very heartening. We hope to keep that fundraising going. It's only through that fundraising that we can continue to import these concentrators and give them to the charity and government hospitals where they are most needed.
Right. In fact, I wanted to ask you about how do you decide, Mr. Khan, where the oxygen concentrators are going to go? Because, there's just such a desperate situation across the country. I know here in Delhi, we talk a lot about these SOS calls coming in from hospitals every single day about running out of oxygen. So you can just imagine what it's like in other parts, in UP, Bihar, Gujarat, Punjab, etc. It's a terrible situation.
Yes. There's no perfect way to decide, where it goes. Unfortunately, we estimate that there's probably a shortage of about 300,000 of these kind of machines in India at the moment. And, we're only able to procure them in the thousands. There are a few other efforts on to also procure them, but they're all drops in the ocean. So, whatever you decide, is just not fulfilling what is actually required to maintain people on oxygen.
Right. And, should there be any sort of organization or, hospitals, etc., that are now looking to get these oxygen concentrators? Would your advice be to them? Can they reach out to you? Would you help guide them on how to go about this entire process? Because I do know there are a lot of groups that are still trying to do this.
Yes, of course. So we have a website, missionoxygen.org. So one is you can come and put in a requisition form in there. And we will include that in the charity quota from the money that we've donated, that we've raised. Secondly, if you're in a position, if you're a hospital that's in a position to buy them yourself, then let us know, and we'll help organize them from the supplies and land them in India and get them to you. So both avenues are possible. Our aim is to try and bring in as many as possible and get them into how many ever hands as possible, but only at the hospital levels. We are not doing any supplies, to people who want to use them at home. It's only for hospitals.
Right, and you know, it's so heartening to see this effort. I think during this entire crisis, the way civil society, citizens have come forward, people, you know, are trying to organize oxygen cylinders for others, medicines, hospital beds, etc. So it's very, very heartening to see, at least, you know, as we're waiting for the government to ensure the supplies and fix whatever problems and obstacles they're having in ensuring oxygen to hospitals, that civil society has come forward in this manner.
Yes, absolutely. You know, as you said, 250 startup founders, some of the best and brightest in our country, have virtually left everything. You know, these guys are not even checking their business emails every day and are only focused on this tremendous effort from people, tremendous selfless dedication. Yeah, you know, it's been very heartening, even from the donation front. People have just come forward voluntarily. We haven't really run a major fundraising effort. People have just come forward from our tweets and social media posts and just contributed. People like Sachin, Tendulkar, Taapsee, Pannu, and so many other people, not well-known people, have just come forward and contributed. It's amazing.
And finally, before you go, is there any issue that is still, you know, a challenge that's troubling you? Any sort of, you know, blockade that you're facing that, you know, you want to request that that could be looked into?
Oh, we've got that pretty much figured out. We've got the entire supply chain working. Like I said, you know, the machines reach the hospitals. Patients are on them. Hundreds of patients, hundreds of lives have been saved. We've got that working. The only thing is we want the fundraising to continue and people to keep contributing to it so we can keep the supply going. There's a massive, massive gap between what can be supplied and what is needed.
All right. Well, thank you so much, Rehan Yar Khan, for speaking to us here at NDTV and telling us about this effort. And thank you to everybody who's contributed to Mission Oxygen and made this a possibility.